Hi, I'm Andrew Pratt,
And I'm Arin Natzke.
and we're going to be talking about our research on the need for occupational therapy in the homeless population. Occupational therapy is a growing field that is expanding its areas of service. The homeless are underserved in our society. According to Family Promise 2020, almost 40 million people in the U.S. live below the poverty line, and about 600,000 of those are homeless. Life in poverty affects people in physical, social, and economic ways that impacts their daily routines. According to the World Bank, the COVID-19 pandemic is estimated to push an additional 88 million to 115 million people into extreme poverty this year, with the total rising to as many as 150 million by the end of the year. For individuals experiencing homelessness, there is an alarmingly low amount of research that addresses the difficulties they face and how they can benefit from occupational therapy services. Research is needed now to understand the role of occupational therapy and how it will affect the future in the population. The purpose of this scoping review was to evaluate available literature in order to explore the importance of occupational therapy and its impact on the homeless population. Clinical observation may indicate that occupational therapy is a necessary service for those experiencing homelessness, but there is a lack of evidence that builds on this topic. And for our objectives that we identified, we had two questions we wanted to answer. What influences the gap between occupational therapists working with clients in the homeless population? And can occupational therapists make a measurable difference in the lives of those in the homeless population? For our methods, we used the PRISMA SCR method to guide the authors through the scoping review. All articles were found utilizing CINAHL and PubMed databases only. We narrowed the literature search to include only meta-analysis, survey interviews, focus groups, and systematic reviews. And our search syntax included keywords and phrases such as occupational therapy, low income, youth, occupational therapy interventions, occupational performance, and homeless experiencing homelessness.
Our findings, we included 6 studies into our findings that all had qualitative approaches, which all the studies working with participants had less than 25 sample sizes, less than 25 participants, and only one having 8. The approaches used are focus groups, semi-structured interviews, lived experiences, and in the included studies, a wide range of topics were investigated, including the participants' responses on barriers that impede participation in their community, performing meaningful occupations while currently living in homelessness, transitions from homelessness to becoming housed, and how young people participate in occupations and organize their daily routines. 2 articles address the needs of rural communities and increase the support of professional development within the community practice. 4 of the articles address occupational needs within the homeless population, while 2 articles discuss the difficulties and needs of OTs within this area. For the articles above, implications for occupational therapy practice in this setting are bulleted below. Further research is recommended to the use of COPs for the purpose of occupational therapists continuing professional development. Current OT programs need to expand to meet developmental needs in rural communities. Future research is needed when working with those experiencing homelessness, and OTs have an important role in addressing the problem of homelessness, and roles are currently emerging in many communities in the United States and Canada. Discussion. Why does OT have a weak presence working with the homeless population? Inability to obtain and retain employment in this setting, and homeless individuals don't readily participate in this setting. And little research exists concerning the needs of rural versus urban communities. Can OTs improve the situation of homeless individuals? OTs can assist in ADLs, IADLs, all areas in the domain that OTs can help. Occupational therapists can be the bridge between homeless clients and the resources available. And what is needed to empower occupational therapists work in this population? Community and practice to provide professional development are needed within this area. Limitations. While conducting this present review, certain limitations were encountered, including the present study was limited due to small sample sizes, the limited research from OT's perspective. The research was not fully representative of all community types, such as rural or urban, and due to limited access to research in the United States, studies were adjusted to include